Welcome back. They treat the youngest Central Texans in the most life-threatening situations, pediatric emergency room doctors. And this morning we're getting an update on a new program designed to get more children's trauma doctors trained. Dr. Sujit Iyer with Seton Healthcare is here. Good morning to you.
Good morning.
You helped run this new program, kind of kicked things off back in December, but it's getting going this summer is when you guys hit the ground running. So tell me what it's all about.
That's right. We'll have our first 4 trainees starting in July. By the end of 3 years, this will be one of the top 5 largest training programs for pediatric emergency medicine. And these are going to be the experts in pediatric emergency medicine. They'll be clinical experts working at one of the busiest children's hospitals in the country. They're going to be experts in research, and they're going to be experts at being advocates for children, not just within the walls of the hospital, but actually out in our community and even internationally.
They've gone through the residency already, but the training, they need more, basically.
That's right. And so you really become an expert, not just in taking care of children, but taking care of them in the most dire of emergencies in the emergency department in our level 1 trauma center.
So 4 doctors starting this program out, they'll be trained by 18, I think I read, trained doctors who are some of the top in our area treating kids.
That's right. Those 18 all completed a fellowship also. So after medical school, they finished residency and then spent an extra 3 years doing this type of training to become experts, not only clinically, but to develop research projects that advances the care of medicine in the emergency field for kids, and also actually develops programs outside of the hospital to take care of the community.
Is the population growth a direct result of Dell Children's seeing more kids coming through the doors?
Absolutely. We see almost 80,000 children last year, which already makes us one of the top 10% in terms of size for pediatric emergency departments. And we've had about 15% growth ever since we've had the new freestanding building.
What is the hope for this program? You're starting out with the first 4, and then what?
I think the hope is that the sign is that this is really an investment to make this one of the best programs in the United States. Within 3 years, we will be as big as a program in Harvard or Philadelphia, and we really hope to put the stamp of Austin on top of this program, have them out in the community, really interacting with the community and helping to actually improve children's health before emergencies start. And we hope that all happens concurrently with the development of the medical school. You can't have a medical school without programs like this, and programs like this cannot exist without top-tier medical schools.
And what would the alternative be if you didn't have a program like this? Would these doctors have to go to a different city or a different environment to learn?
That's right. Up until now, you couldn't come to Central Texas to do this type of training. You could only go to Houston or Dallas in the state of Texas.
Okay, Dr. Iyer, we are out of time. Thank you so much for joining us this morning, and thank you for the work that you and your fellow doctors do.